News Channel 8 presents New Skills for Living with your host, Tom Lavin, a healthy plan for healthy living.
Hello and welcome to New Skills for Living, a show dedicated to healing and wholeness in our community. If you or a family member or loved one has ever suffered with a mental illness, and on top of that with an addictive disorder, you'll want to watch our show today because we're going to talk about how do people recover from that combination of having a mental illness as well as a substance abuse issue. And then later in the show, we're also going to talk about people who have a mental illness as well as a chronic illness. How do they recover? And we have two great expert guests with us today. To my immediate right is Laura Leon, and Laura is a psychiatric nurse at Northern Nevada Adult Mental Health Services. Laura works in the outpatient medication clinic, and she is also the primary nurse psychoeducation specialist for the intensive outpatient program at Adult Mental Health. Laura, it's so great to have you here as a guest.
Thanks for having me, Tom.
Thanks for being here.
Thank
And
you.
to my far right is Donna Heim. Donna is a psychiatric nurse with over 10 years experience in psychiatric nursing. Donna, too, works at Northern Nevada Adult Mental Health Services in the outpatient clinic. However, she has also worked at some other settings like the intensive settings with outpatients as well as hospital-based psychiatric care. And Donna, it's so great to have you here. Thank you so much for being here.
Thanks for having me, Tom.
All right. Well, it's so good to have you guys here to share your experience and your expertise. And Laura, I guess the first question I want to start off with you is, can you tell us what is a dual disorder when we're talking about mental health and substance abuse?
Okay, sure, Tom. A dual disorder is any person who might be diagnosed with a mental disorder, a mental illness, and a substance abuse problem. So an example of that would be depression. Someone may be diagnosed with depression, and they also have an alcohol problem, or schizophrenia, but they may also be using methamphetamines at the same time. So it's any type of mental disorder along with substance abuse.
So as psychiatric nurses then, you're treating the person for both of their disorders, Donna. Can you tell us a little bit more? Laura mentioned a couple. What are some of the more common illnesses or diagnoses that people have that you guys work with?
Well, depression is one, schizophrenia, bipolar disorder, PTSD.
And anxiety disorder, of course, is another one
Definitely.
that you guys work with. And then what are the drugs then that people, of course, use those drugs to self-medicate or to escape? What drugs do these people with those mental illnesses frequently take, Donna?
Well, number one seems to be methamphetamine. Unfortunately, that's very prevalent. You see a lot of heroin addiction, of course, alcohol, and I would say some hallucinogenics, but that's not as common as amphetamines.
And then sometimes marijuana to reduce the anxiety, huh?
Sure.
Yeah.
You see that.
So, with you guys working every day in the psychiatric field, of course, when you say depression or bipolar disorder, you know automatically what that is. But Laura, would you tell us what is depression? Like, what are the common signs of depression so that people in our audience might be able to identify that in themselves or a loved one?
Common signs of depression would be isolation, wanting to sleep too much, or insomnia, having trouble sleeping at night. I said isolation, right? Other signs of depression are tearfulness, wanting to cry all the time for maybe no reason at all. Irritability. Some people who are depressed can get easily agitated or easily overwhelmed by little things in life. Even thoughts of suicide. Thoughts of suicide will come with depression sometimes for some people. And, it can happen, it can get so big that person will isolate themselves and not reach out to any family or friends.
Yes.
And then the more they isolate, the worse it gets.
Yeah. And then, of course, and this is the work that you guys do with the dual disorders client, it's so easy to sit at home and get involved then with alcohol or marijuana or other drugs. And what about bipolar disorder? If people in our audience, Donna, are wondering, well, these psychiatric nurses are talking about bipolar disorder, and they're saying, what is that? What is manic depression or bipolar? Could you explain that to us, please?
Well, I think just to add to what Laura said, depression is one side of the bipolar disorder. And along with that is just a loss of doing the things you enjoy in life, that you feel that you are dragging your body around the planet and you don't know why. And with a manic phase or a hypomanic phase, and a lot of times what they say here in our country is a hypomanic phase is sort of a very productive person, so it gets rewarded. But that can accelerate into a manic phase where you are up all the time, you can't focus, you're racing thoughts, you keep going and you keep going and you keep going until the engine runs out of steam, and then you plummet back down into depression. And that's kind of the cycle of the bipolar phase. And you can be slow to do that, and it can work well for you for several years, and then boom, you're depressed. Or you could cycle rapidly where you're up and down and up and down and you just can't function.
Yeah. And of course, as you guys described those two mood disorders, it's so easy to understand how someone might turn to methamphetamine for more energy, or for alcohol to kind of tamp down the hypomania or the mania. And this was a great first segment, and right after this brief break, we're going to hear more from Laura and Donna about recovery from dual disorders. Hello and welcome back to New Skills for Living. We're talking about recovery from dual disorders. And Donna, one of the disorders you mentioned in the first segment was someone that might have an anxiety disorder like generalized anxiety or PTSD, and then their use of alcohol or drugs. Can you tell us a little bit more about that, please?
Well, someone with anxiety can be functioning in their normal daily life, but certain things come about during the day or throughout the day that cause them, we'll say, undue stress. Simple things that normally wouldn't affect you send you into a tailspin and you can't cope. Things people might associate with that might be road rage, where normally you might be sitting in traffic dealing with things like anybody else, but all of a sudden you snap and your heart rate goes up and you can't think straight, and it just feels like you're spiraling out of control. That's kind of an extreme, but I think there's all kinds of variances with that. And it could hit you at any time. You might just have a generalized anxiety disorder where you don't really know why you're so anxious, but it's there. You're doing the dishes and all of a sudden you're having a meltdown and you don't really know why.
Yeah, and of course with generalized anxiety disorder, someone is worrying all the time, aren't they? They're frequently worrying about this or that. And
definitely.
Yeah. And then they turn to substances, huh, Donna, to self-medicate, to make that thought pattern or make those feelings go away. Can you tell us a little bit about that, please?
Well, I think that a lot of times they look for more things that will subdue that, and that could be alcohol, that could be heroin, which would be a real extreme. Marijuana is very commonly used to reduce anxiety. And if they're not getting out there and getting help or recognizing what's going on with them, I could see where people do turn to those things.
Yes, yes, they do.
Unfortunately.
Yeah. And of course, Laura, another anxiety disorder is post-traumatic stress disorder. Can you tell us a little bit about the signs and symptoms of that and people's use of alcohol and drugs to self-medicate with that?
Okay, with post-traumatic stress, the symptoms that we might see would be a hypervigilance.
Which is what?
Hypervigilance would be, it's always being on the lookout
Yes.
for something, always being just hyper aware of your surroundings.
Yeah.
People who are hypervigilant become easily startled.
Yes.
And they're always looking around, waiting for something bad to happen.
Yeah.
And then, like you guys were just talking about, anxiety. Anxiety comes with post-traumatic stress. And PTSD can be triggered by something in the present moment that might remind that person of something that happened in the past.
Yeah.
And it can bring all those old feelings back if those feelings weren't recognized in the past in therapy. It brings it all back, but the person isn't sure why they're feeling the way they do.
Yeah. And again, that tie-in then that someone would want to drink or take drugs, which seems like a solution to make those symptoms go away, but then it becomes really more a part of the problem, doesn't it? And you guys see hundreds of patients every month, and I was wondering, can you talk with us, what are the consequences, Donna, of someone that has these dual disorders? What are the consequences in their life?
Wow, that's a big question.
Yeah.
I think that it's the consequences can be mild or devastating. It seems that they can start out slow and have impacts on life, not taking care of responsibilities, which seems to snowball into job loss, effects on health, money issues because they're buying this drug, or getting so far down to a level where now you've lost your family, you've lost your job, you have no money, and you're doing things that you wouldn't normally do for your drug.
Yes, yes.
So it can run the gamut.
Yeah. And we have about a half a minute, Laura, but what are some of the consequences for families where someone has this mental illness and substance abuse issue?
A lot of families become broken families because the person isn't available, whether it be physically or emotionally, or even spiritually, if you want to get into that. But it really devastates families. You know, children's lives are affected. You know, if the parent is using, how is that parent going to help the child when they're at school with their homework? And there's just so many different ways that it can affect the family that you know.
So there is a devastating effect, and of course we've gone through the dual disorders and we've gone through the effects, and right after this brief break we're going to get back and we're going to talk about the recovery process. What can people do to help themselves? And you'll see up on your screen right now the website where you can see this whole series on addictive disorder recovery, and you'll also be able to rewatch this interview with Donna and Laura up on the website, easeap.com. We'll see you right after this brief break. Hello, and welcome back to New Skills for Living. We're talking about recovery from dual disorders with two expert psychiatric nurses from Northern Nevada Adult Mental Health Services. So, Laura, what about recovery? Can you tell us about the recovery process? Because the good news is people do recover.
That is the good news, and there is hope for people out
Yeah.
there who are struggling with either a mental illness or substance, or both.
Yes.
So there's so many resources out in the community. There's, you know, there's a lot of support groups like Alcoholics Anonymous or Narcotics Anonymous for loved ones of people who are abusing substances. There's Al-Anon, so a lot of 12-step groups. Then, you know, there's the two different psychiatric hospitals here in our community, West Hills, and then Life Skills is another place that people can go, or Northern Nevada Adult Mental Health. If you just look in your phone book and call any of those numbers, you will find someone to direct you to where you need to go.
Yeah. Yeah, that's great that we have those resources in our community. Donna, what would you want to add about the recovery process and recovery resources here in our community?
Well, I'd say, first of all, if you're struggling with substance abuse or a mental disorder, get help. Don't isolate. Don't think you're alone. Come in, put your hand out, because there's a lot of people waiting at the door to help you. And I would say it can be a long, hard road, but you can get there. There is hope, and there's help for you.
Yeah, especially people that have suffered with a mental illness and then substance abuse. That stigma and that sense of shame and fear about reaching out for help. Don, I'm really glad that you talked about that. And of course, there is Dual Recovery Anonymous, too, for people that do suffer with these dual disorders. What can people expect if they go to NAMS outpatient and they see you as the nurse and you're helping out the doctor? What can people expect from a nurse and a doctor at the med clinic at NAMS if they have a dual disorder?
At the med clinic, when people, get through the gate and then they end up over at the med clinic, first they'll check in with the nurse, and we'll check all the vital signs and ask a series of questions, and then when they see the psychiatrist, they will then be prescribed a certain medication that might help them get through whatever difficulties they're having at that time. But we will also make referrals to so many different places. Like I mentioned earlier, we do a lot of referrals to AA or NA. We refer to the intensive outpatient program, like we talked about earlier. We refer to counseling a lot, and that brings to mind how important it is to not only go and just take medication, take a pill, and think that your life is going to change and get better. Therapy is also very, very important in recovering from mental illness, dual diagnosis.
Yeah, that's a good point. Donna, can you tell us a little bit more then about when someone reaches out for help? And we only have like about a minute and a half right now, but what is the recovery process like for a person that's reaching out for help and they're willing to confront their mental illness and let go of their substances? What's in store for them?
Well, I think they have to realize that it wasn't easy getting in those shoes, and it's going to take a while to get out of it. But just to add to what Laura said, once you're initially assessed at our facility, we really try to meet all your needs, whether it's a financial problem. We have referrals to many, many community resources that will help you from A to Z, really.
And of course, along with the counseling, at NAMS you also provide psychiatric medications for people.
Yes.
They're so expensive, sometimes people are afraid to get help because they can't afford it, but at NAMS people have subsidized medications, don't they?
Yes, they do, and if our medication isn't necessarily available, there's a lot of resources out there to help people get their medication.
That's a good point, Donna.
Yeah.
And this is some good news from two really well-experienced expert psychiatric nurses, and we'll continue this discussion right after this brief break. Well, and welcome back to New Skills for Living. Earlier we were talking in the show about dual disorders, people that have a mental illness and a substance abuse or an addiction. Now we're going to shift a little bit, and we're going to talk with our two psychiatric nurses about people that have a mental illness and a chronic physical illness. Donna, let me ask you first, what are the more common physical illnesses that you see in your mental health clients?
Well, again, there's a lot of issues. I would say physical illnesses that are common would be obesity and diabetes, coronary artery disease, hypertension, high cholesterol, and all those things play together, and you can have someone with all of them, which would be referred to as metabolic syndrome.
Yes.
And psychiatric medication sometimes plays a role in that, which you have to look at that component. And so I think it's really important to look at the whole person, make sure that their medical issues have been addressed, so that if, for instance, they had a thyroid issue and they had hypothyroidism, that may cause symptoms of depression. But you want to make sure that it's not a thyroid issue, and so you have to look at the medical component of it and rule those things out, and then also address the mental illness part of it after you've removed the medical issues from
I really like
equation.
Yes, I like what you said about you guys looking at the whole person and treating the whole person. Laura, from your experience as a nurse, what would you add to what Donna said about the mental health clients who also have a chronic physical illness?
A lot of chronic physical illness that we see can be treated and improved if that person is willing to take the responsibility to take good care of themselves. And I think that that's really important to stress to the people that we see, because a lot of times people will give up, and they'll give up on themselves, and they won't do the things they need to do that will improve their lives. So even if it's just a baby step, getting out of the house once a day and walking for 30 minutes, that can improve mood, it can improve physical health, the exercise. And nutrition. Nutrition's really important too. There are ways to eat healthy that aren't so expensive. A lot of people will say, well, eating healthy is too expensive. You know, there are ways that people can eat healthy without breaking their budget.
Yeah.
So diet and exercise is really important.
Yeah, I really like that holistic aspect there. And in these last 30 seconds, Donna, if someone's watching our show and they go, wow, maybe I have a dual disorder, what would you say to them about following up, getting help?
Get help now. Don't waste another day of your life suffering. That's what I would say.
Yeah, don't waste another day of your life. Go ahead and reach out and
definitely reach out, because it's
have the courage and don't be ashamed.
Well, definitely don't be ashamed, because you're not alone.
I'm going to have you guys back to New Skills for Living. It's so great to have you here, Donna and Laura. Thank you so much for coming and sharing your wisdom with us. We really appreciate it. This was a good topic. I think it'll be really helpful to a lot of people in our community. And we'll see you here at New Skills for Living next